All right, so we are going to talk about one of the ventilators we have here at Sentinel. This is a Hallowell ventilator, probably the most common ventilator you're going to run into in veterinary medicine right now. And just a quick little overview on how it works. It's what we consider a dual circuit ventilator. It's powered by compressed oxygen, and it's cycled by a little chip within it that's time cycled, which we'll talk about here in a second. So basically you're going to have some bellows housing, which is this clear acrylic piece, and then inside of this housing is actually a little black tube. This is the pediatric one, so you can ventilate patients up to 300 mils. And essentially this bellows is a replication of your rebreathing bag, that if your patient was spontaneously ventilating and you'd have this part on your machine, basically when you put the patient on a ventilator, this part becomes this part. So as far as setup goes for this machine, just the basics of what needs to be plugged into what is this particular ventilator needs to have electricity because of the time cycled component. And so we have it plugged in here behind me. You just have to make sure your power cord is plugged in. And then the firing of the bellows is by compressed oxygen. And so on the back of this machine, you'll see an oxygen line, and that is the gas that comes into the machine that fires into this acrylic piece and pushes the bellows down. So you need to make sure it's hooked up to oxygen. And then a couple other things on the back of the machine, you'll see a hose for the breathing system. And so that hose is this guy right here. And what you're gonna do is, there's the breathing system tag right there. And so basically you take this and you're gonna hook it up to exactly what it says to do. Hook it up to the breathing system. So we're gonna put it right here, which is where your reservoir bag, also known as a rebreathing bag, would have been. And so once you hook that up, you can actually close your pop-off valve. And the reason why you can close your pop-off valve is because there's a built-in pop-off valve on the back of this machine. And so it will pop off when it needs to, so you don't over-pressurize the circuit. And then the other part of these machines is there's an exhaust hose, and it says here on the back, exhaust, which is this guy right here. And so you just want to make sure that this hose is hooked up to your exhaust system on your machine. And every anesthesia machine often has a different scavenge system. And so we need to make sure that where it says exhaust, that's actually hooked up to our scavenge system, because that's the hose that is going to make sure all the isoflurane gases are scavenged away from us and away from the operating room back into the walls, wherever they go. So that's kind of the basics of how this machine works and how it's set up. So why don't we just talk about how we're gonna use this in a real patient. I'm just gonna put this bellow housing back on now that I took it off. And these are just acrylic tubes that fit on top. This is a little bit wrinkled, but that's okay. It will level itself out here once we get the machine going. But you'll put the housing on, make sure you have the bellows on that you want, and then you'll twist it so you get to these little brackets. And a lot of people think you need to tighten these. You don't need to tighten these brackets. There's a big rubber O-ring around the bottom of this, and that O-ring comes lubricated, and so you just need to put the cylinder on and turn it into its spots, and you're good to go. So we've got it hooked up to where our breathing bag should be. We have our pop-off valve closed. We're gonna have our oxygen on. Why isn't my oxygen on? Oh, there it is. It's just tiny. I didn't turn it enough times. So you're gonna have your oxygen on, and let's say it's on, 1 liter per minute, or wherever you're gonna set it for your patient. And then the other thing to make sure you have on this machine, for this machine to work, is your pressure reader. So this is your capnograph line, which we're gonna leave up here because we don't have a real patient. But This piece of tubing is really important, and if you don't have this tubing hooked up to your inspiratory limb, it can also be on the expiratory limb, but it has to be on one of them. When you turn the machine on, it will just alarm, 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 and it will drive you absolutely crazy, and you'll be like, why is this alarming at me? Probably because you don't have your pressure reader on the inspiratory limb of the machine. So we've got that set up, we've got our pop-off valve closed, we have our oxygen flow on, we'll have them on whatever percent isoflurane. We have our scavenge on the back of the machine hooked up to our active scavenging unit. And now I need to get rebreathing hoses for right here, which I didn't grab.